mobility of the lumbar spine. In that, now we are going to see the lumbar pelvic rhythm. Lumbar pelvic rhythm. What is this lumbar pelvic rhythm? It's very easy to understand. It's very easy to understand. Suppose now if the person is doing lumbar spine flexion. Suppose we are taking example. One person he is trying to touch the floor, okay, or toes. Touch the floor or toes. So when he attempted to touch, see here, this is floor, okay. In first diagram, he didn't touch the floor. Second diagram, he touched the floor. So imagine if the patient is doing first, it will happen flexion of the lumbar spine. Flexion of the lumbar spine will happen. So as we are seeing here, just imagine. So this is the cervical spine. This is thoracic spine. This is lumbar spine. These are our hip bone, hip joint, knee joint. Okay. Here person is trying to bend. So this is the patient hand. This is the person hand. Okay. So when he is trying to touch the floor, first what will happen? Flexion of the lumbar spine will happen. After that, second step, to reach the floor. Here he need little more movement, little more flexion movement. So that time what will happen? Anterior pelvic tilt. So the pelvis which are present here pelvis is in neutral position. So when he touch the floor, so that time the pelvis which are present here, it will move in this direction. The pelvis should move in anterior, inferior downward direction. The downward, see here, the pelvis which is here, it is going to move in this direction. Pelvis has to move in this direction. So here already pelvis is moved. So that is nothing but anterior pelvic tilt. So anterior pelvic tilt will happen. So with this anterior pelvic tilt, he can get the more range of motion in the flexion, so that patient can easily touch the floor. That is what lumbar pelvic rhythm. So here the lumbar range of motion is going to take the assistance to increase the ROM. It's going to take the assistance from the pelvis. So both together, lumbar component and pelvic component, both together are going to do the movement, achieve what movement is required. So that movement will be done by these two structures. So that's why it is called lumbar pelvic rhythm. So these two structures will follow a rhythmic pattern. First this one, next this one. So that's why these are lumbar pelvic rhythm. So this one point. Okay. Now if you see, when the person is coming back, when the person here he touched the floor, when the person is coming back to normal position, what will happen here? If we see first case, here patient is touching the floor. When patient is touching the floor, first movement is flexion of the spine. Second movement is anterior pelvic tilt. When the patient is coming to normal position, or neutral position, what will happen? First movement, posterior pelvic tilt will happen. First movement. So here already pelvic came in this direction. If he need normal position, pelvis has to move like this backward. Pelvis has to move like this. So here pelvis will move. So that is posterior pelvic tilt. Second here lumbar spine flexion. No? Next second point, lumbar spine will come for extension. Lumbar spine should do extension movement. Here already it is flexed. So here it is flexion. No? Lumbar spine. Here also it is flexed first. So if you need normal position, here lumbar spine has to do extension. So here posterior tilt followed by the lumbar spine extension is going to create the neutral. Is going to get the neutral position of the patient. Here to get complete flexion and lateral to get complete flexion. Here lumbar spine flexion followed by the anterior pelvic tilt. Lumbar spine flexion followed by anterior pelvic tilt. Otherwise posterior pelvic tilt followed by lumbar spine extension. These two together we can say like lumbar pelvic rhythm. Clear?